Tonight we continue our series Cuts and Consequences, taking a look at how the state budget reductions throughout 2017 are affecting our healthcare and criminal justice systems.
MTN's Augusta McDonald has more on losses to Montana's community-based mental health care system, where dozens of lost jobs and closed offices are cutting a large swath in western Montana's mental health care resources.
Western Montana Mental Health Center absorbed some serious cuts to case management services funding, ended up cutting 60 case management positions statewide. I sat down with interim CEO Paul Myers to talk about community-based mental health care. What is it, and why are these cuts proven to be so detrimental? Paul Myers is filling in while WMMHC recruits a new CEO, but he'd previously worked for the organization for almost 30 years.
I think they didn't think through the consequences of what they were doing. They're decimating some community pieces that have been in place for decades and have been the underpinnings of the community support system. And when you take that away from people, inevitably you create chaos in the system, and I think these cuts have done that.
He says case management is a foundational service for many people living with serious mental illnesses like schizophrenia, bipolar disorder, and major depression. Their case management program for both adults and children lost 60% of its funding due to the cuts.
That's been horribly disruptive across the region, I think, for those folks who had long-term relationships with those case managers, and for the work that those case managers did, which was really keeping people stable in their homes, their jobs, their relationships.
In rural areas, WMMHC closed offices. Libby, Dillon, and Livingston lost their programs, and a youth home for girls was closed in Kalispell. They have plans to rebuild programs and hire staff as state funding stabilizes.
We've gone through ups and downs before. This is the most severe contraction we've seen, though, and maybe unnecessary if in fact the revenues aren't as bad as were projected. So I mean, that's really disheartening at this point to discover that there might have all of this chaos may not have been necessary.
To offer some level of replacement services for adults, he says they've established a mobile treatment program in Kalispell, Missoula, Hamilton, and Butte. A day treatment center was also able to continue its services in Missoula.
We're trying to get our feet under us, stabilize the organization enough so that we can move forward with the programs we have in place. They're not as comprehensive as they were before, but we're making an effort to make sense out of this lemonade that we've been asked to serve everybody.
If you or someone you know is interested in more information about the services available now through Western Montana Mental Health Center, please visit our website or check out our app. In Missoula, Augusta McDonald, MTN News.
And May is Mental Health Awareness Month, and the Western Montana Mental Health Center does plan to hold some events.